This is another one of our free wellness webinars. Every month we focus on a particular topic, and this month we're going to be talking about dining out, exactly what that means, what it entails. I like talking about this particular topic in the late spring / summer months, because I think a lot of us enjoy getting out of the house, and we'll talk a little bit too about how we even define dining out. And so before we officially begin, let me go through, excuse me, my usual housekeeping things, etc. So what to expect in this month's webinar. We hope that you learn a little bit more about, we're going to focus specifically on restaurants and large scale establishments. So understanding restaurant menus and nutrition information, and also inspection grades. We're going to talk about eating to support your condition if you are managing a chronic condition, or you have a food allergy or a food preference. And we'll also talk a little bit too about how to manage budget if budget is an issue, because sometimes it does cost a little bit more to eat outside. And then, excuse me, we'll also talk about identifying some healthier options and making better informed choices, because eating out by nature feels a bit indulgent. That might be a time where, we kind of allow ourselves a little bit more flexibility, or we allow ourselves to be tempted by some things. And we'll talk a little bit more about that soon. So as always, as you heard me say just now, or you probably heard as you're coming in, the session is recorded. You can always use the chat box at any time if you want to engage in conversation or need me to clarify anything, but we'll definitely have some time at the end of this webinar where you can have Q&A if you feel like unmuting yourself, raising your hand, or putting any questions in the chat box. That I'll stop and officially answer then. I always disclaim this: while I'm a registered dietitian, I'm not your dietitian. So please make sure that you are following your proper personal, individual medical advice. Make sure you're meeting with your own clinicians, your healthcare providers, and be sure to get medical clearance if you decide to do any kind of changes, whether it's in your diet or physical activity or medicine regimens, anything like that. So I'm Dina D'Alessandro, as I'm sure you know by now, registered dietitian, nutritionist. I'll introduce myself a little bit more formally in the next slide. But anytime you register for any of these webinars, we automatically receive your email, your contact information, and we throw it into an email distribution list. So we have a mailing list that we send out newsletters every month. And whenever you watch these webinars, or even if you can't watch them, like a lot of times we have tons of people registering for it, but just a handful of people can actually make the live webinar. So you can always watch this at a later date, and then we'll send a survey link and the recording of this. So if you couldn't make it live, at least you can catch up with the recording. So here we go. That's me. I'm Dina the dietitian. For those of you who don't know exactly what I do, I work out of New York City and in Ocean County, New Jersey, and very much on the virtual space, a lot of telehealth things that I'm doing nowadays too, both as a registered dietitian. So I do nutrition counseling, and I'm also an adjunct lecturer up in the Bronx in New York City, where I know some of you who are registered know me from. You might be my former students or current interns. We might have worked together in some way. I'm also the campus dietitian, campus nutritionist there at Lehman College as well, in the Student Health Center. Not right now, because it's the summertime at the time of this webinar and this recording. But in the spring and the fall, I've been doing that for the past 6 years, and I've been a dietitian for the past 8 years. I have a lot under my belt as far as experience is concerned. I'm very grateful anytime anybody wants to talk to me or listen to me about anything. So I really appreciate your time and attention, and I hope I do come across as an expert in my field. I hope that I can help you gain more knowledge and insight. And I always like to say, I try to take people from confused to confident when it comes to anything in the health and wellness world, whether you are currently diagnosed with the chronic condition, you've been managing something for a really long time, just want to learn new information about certain topics. I hope you're gaining a lot of insight into this. So thanks for joining. Okay. I don't usually talk about calories. Like, I don't make people track and weigh and measure anything, but we have some information in this webinar that has to do with calories, especially when it comes to the labeling mechanisms, the menus and things that you'll be seeing in certain restaurants and other food establishments. There's going to be labels listed on stuff. So not everybody knows what they're quote unquote supposed to eat. And from what I've come to see, either people eat much in excess of what they are, quote unquote, again, supposed to eat for their body, their physical activity level, their age, etc. They're overeating certain things because they don't know that they maybe don't feel full over something, or they're not sure how to create meals for themselves. Or more often, they're under eating because they're constantly restricting their diet because they're told from one way or another that's what they should do. So let's do a quick little calculation. This is a pop quiz for anybody who happens to be in school right now. In the health sciences world, we use metric units of measurement. In America, we don't use units of measurement. So this will require you to do some a conversion. So on average, as just a shortcut, in general, okay, I'm just saying there's a lot of individual customization to this, but on average, in general, if I had to kind of make my best guess as to how many calories someone needs, I would base that off of just their body weight for the time being. Like I said, in the usual circumstances, I have a much more in-depth calculation, and it really just depends on if I'm trying to keep somebody alive in a hospital setting versus helping them replenish their stores if they're moving around a lot, so I can give them some guidance. And so that'll come into handy here too. So let's just do this as an example, right? As an example, I might even put this in the chat just as an FYI. All right, so I'm going to pretend like I'm using an average weight of 150 pounds, but I need to convert that into kilos. So usually what we do is we use about 2.2 as a conversion factor. So I'm just going to divide 150 by 2.2, and that'll give me about 68 and change, give or take, 68 and change kilos. Okay, so I'm putting that in the chat right now. That's what 150 pounds turns into in kilograms. So if I'm taking 68 kilograms and I'm using a range of about 25 to 35 kcals, that's kilocalories, that's officially the name of calories per kilogram of body weight. So again, now I'm taking my 68 kilos and I'm multiplying that by 25 kcals. That's the low end, right? So on average, I'm going to get about 1,700 calories per day. That's about 1,700 calories per day. And then I'm also going, so bear with me as I put this in the chat here, and I'm also going to do the high end. So I have this range of high-low, right? So 25 calories to 35 calories. So let's do that again. If I take 68 kilos and I multiply that by 35, now I'm on the high end, and that's 22,380. So let's just say 2,400. Now I realize when I put this in, if you happen to weigh that much, or if you're doing your own calculation at home, you might think, oh my gosh, that's too small, that's too big, that's too small of a number. Again, this is just kind of a shortcut just to give me an idea of about how much. And this could also give you an idea of about how much in case when you do go shopping, looking at nutrition labels, looking at the restaurant menus, etc., then you can kind of use that information as a guideline. And you'll see this come up in a second, although I'm thinking, I don't think I have exact examples, but I'll explain a little bit more as we progress through. So when you're eating out, okay, if you're at a restaurant, whether it's McDonald's or Panera, Starbucks, or a different kind of chain restaurant like P.F. Chang's, or trying to think of some higher end ones too that might be like Outback Steakhouse or Cheesecake Factory, if those still exist, they usually will have their labels and menu items with the calories. And so if you're looking at stuff to eat, this can give you a good idea of whether something might be a little bit off the charts for you, or if it fits within what you might need in your daily calorie needs. So this is why you just want to be an educated consumer, and hopefully that will help with just knowing what the starting point is. So here we just have some statistics. This is kind of neat to know. A really good majority, and by the way, whenever you see things like this, like Americans, right, percentage of Americans say whatever, I usually go and look at the actual report. In this case, it was a survey done by some food service company, and I think they surveyed about 8,000 people. So 81% of those 8,000 people, not 81% of the 300,000 or however many we have, 300,000, 33,000 in America. So just use that with no pun intended, a grain of salt. So 81% of the Americans that were surveyed in that report cook more than half their meals at home, which is wonderful. We like to be in control of what we're eating, and we like to be able to maybe even enjoy cooking and shopping and doing things like that on our own. 64% of Americans say that they do it because they want to save money, because it can cost a lot of money to eat out. And 29% of those Americans that were surveyed said that they eat out once a week or more. So that's about, a third of the population that they surveyed saying that they go out once a week or more, whether it's a lunchtime during work, or they go out for, maybe like a Friday night pizza night or takeout night, whatever the case may be, takeout, eat in type of thing. So here, let's talk a little bit about back in, I think, 2010 through 2018, the the FDA, the Food and Drug Administration from the government, from the US, put into place a new law that stated that certain restaurant establishments considered covered establishments had to start disclaiming information on their menus and menu boards. So when you see something, on the top of, when you walk into a restaurant, on the top of their wall, or if it's a drive-through type of deal where you see a menu board, or you're actually holding a menu in your hand, or you're looking something up online, there's now supposed to be a calorie information. So this is the menu labeling laws that went into effect. On the left-hand side, you can see that there were certain stipulations, criteria that had to, thank you, Johanna, thank you, that had to be met. So depending on if this particular chain, this restaurant chain, has at least 20 locations, they had to meet this criteria, and this became a law. So they usually give a handful of years for everybody to comply, because they have to go in and update their printing, and they have to go in and actually do nutrition analyses on these things to be able to give the proper information. So chain restaurants and similar food establishments now with 20 or more locations have to have calorie information listed on their menus or their menu board. They also have to put in a statement that disclaims something along the lines of, so obviously what I just did with all of you, where I gave you an example of an average amount of calories for a 150-pound person, usually in America, on any nutrition facts labeling, we use a standard amount of about 2,000 calories per day. So the menu labeling laws include that as well. So now these food establishments have to also kind of say, this is based on a 2,000 calorie diet. Your individual needs might be different, and they have to make a statement like that. So the labeling laws now also included parts of different states and localities could also encourage or provide additional information through campaigns and education programs. So I'm speaking specifically as a New Yorker, where the New York City Department of Health and Mental Hygiene, they go through public health messaging, and they'll do things like, did you know that there's this many calories in soda? Or did you know that an average hamburger has this much sodium, or whatever? So they can include that sort of educational component in whatever they're doing as part of this new labeling requirement. Now, because especially of COVID, right? So a handful of years ago, when we switched off and everybody kind of had to close down their in-person establishments, a lot of restaurants had never done things like drive-through or pickup. So sometimes during cases of public health emergencies or outbreaks, or whenever an establishment does have to close down, there could be some flexibility to those laws. So they didn't necessarily have to have information written if people were coming to pick up food, or the restaurant ended up putting sidewalk seating that they never had before, and they had to really rush and get some things done. So they were able to kind of be waived as far as having to meet that. So at least that's far as the labeling goes on the menus that are seen on boards, etc. There also, so think about like grab and go counter items, like the picture you see here, I think is from Starbucks. So they have the little grab and go sandwich, pre-made sandwich items like, turkey, bacon, egg and cheese, or whatever, spinach feta wrap, etc., that you can grab and go. So those, again, because the restaurant has at least 20 locations as a chain, whether it's in a particular location or across the nation, those have to make sure that calories are listed nearby where that food item is going to be selected. So if you have a self-service food item that you're grabbing, it has to be on the label of that food item or nearby as a signage like you can see here. Because some of those things you don't actually touch as a consumer initially, like somebody behind the counter will heat it up for you or wrap it up for you and then hand it to you. So that information has to be available. Just calories so far. So as you can see here, right, so here's a spinach feta wrap, 240 calories, bacon avocado wrap, 380 calories. Maybe you're being mindful of how many calories you're getting in one meal. And as you maybe calculated for yourself, you think, okay, listen, that's about 300, 400 calories for my breakfast item or my lunch item. That's actually not so bad because now I have another, 1,000 something calories to go for the rest of the day. Now, each individual is a little bit different. Calories aren't just the only thing that you need to know when you're eating. So part of the labeling laws, whether it is on a handout or some other place that is accessible or on a website, these restaurant establishments also have to make sure that they are providing to their consumers a list of more in-depth nutritional information. So on the left-hand side there, you see things like total fat, cholesterol, sugar content. So that's kind of like what you would see on a label of a food item that you buy in the grocery store, a can of beans or a package of bread or something like that. All of those things that are on the labels, on the nutrition facts labels of those packaged goods are also going to have to now be accessible to the consumer in these restaurants. So that's something that I find is kind of cool too when I'm working with people who are purposely trying to be conscientious as to what they're taking in. So as an example, Dunkin' Donuts, right? They have amazing amounts of really unique and interesting and very flavorful types of coffees, but some of them have like 68 grams of sugar in them. And some people who are trying to be mindful of their sugar intake might have to be conscientious of that. So just because you're looking at a calorie count of something, you don't necessarily know what the calories are made up of. So you might want to say, can you share with me what the nutrition information is for this food item? Or before you show up to the establishment, if they have a very easy to access website, you can also look up that information ahead of time, and then you can make conscientious choices. As an example, like I'm saying here with the Dunkin' Donuts or Starbucks or whatever, for me, this is something that I do. If I know it has a significant amount of sugar, it's usually part of the syrup that they use, the flavored syrup. So I'll ask them when I go up there to place an order, something like, how many pumps of syrup do you use in your medium-sized coffee? Hazelnut flavor, whatever, cappuccino, something or other. And they'll say, we use 6 pumps. And I'll say, can you just give me 1 pump, 1 or 2 pumps, that's it. Now I've already cut back on that much sugar. And in doing so, I'm also going to be cutting back on my calories too, because we'll talk about this, I think, in our August conversation. Our August webinar is all about macronutrients and food groups. So I'll save what I'm about to get into for that discussion. But just know that carbohydrates and fats and proteins make up your total calories for the day. So if I'm taking away some sugars, that's part of the carbohydrate family. If I'm taking away some cholesterol, that's part of the fat family. If I'm taking away some protein, that's part of the protein family. And so in that are going to be adjustments to my caloric intake, or if I'm adding more things in, like if I'm doubling up on a protein item, then I just have to remember that I'm going to be adding more protein and calories to that particular meal, and I might have to just adjust my, total overall daily calories accordingly. All right, let's move through to the next one just to give you better examples. I just said Dunkin' Donuts is a great example. That's a chain coffee shop, but so are some chain restaurants and bakeries and buffets and salad bars. Movie theaters are part of this list as well, as are some of these grocery convenience stores. So don't forget, not just your corner bodega. If you live in New York City, it might be a small mom and pop run shop, a very small community neighborhood storefront, but we're talking more along the lines of the like 7-Elevens, the Quick Checks, the Stop and Shops, or whatever they're doing as far as like the grocery convenience stores there that have more than 20 locations. Where you will not see calorie information. So again, you're going in trying to say like, hey, I need to make some informed decisions, but you won't see things if they're going to be separated out. So for instance, if you are at a deli counter where they're making a sandwich for you, they're doing, a bacon, egg, and cheese, and they're making it on the grill right there, they will not have information for you in those little tins that you see spread out in front. You also won't see calorie information in anything that's considered a transportation vehicle, like a food truck or an airplane, or any restaurants that have less than 20 stores within their chain. So some people might not be considered a chain, like again, small little mom and pop shops like we have here in New York City, and also across the country too. There might be just a very small independently owned and operated location, and they do not have to abide by these rules. They might want to, but they don't have to. Okay, so now we're going to talk about inspection grades, especially with New York City in mind, because that's where I live, and I actually used to work for the Department of Health. So I'll share with you how and what those letters mean when you go to a restaurant establishment. So on the bottom right-hand side, you have the A, B, and C inspection grades. New York City, so this could be anywhere in the country, right? Every Department of Health has a different way of doing this. So if you do not live in New York, you might just want to check this out on your own individual Department of Health website. But New York City conducts at least one a year, unannounced inspections to make sure that the restaurant is abiding by safety compliance. So I actually teach food safety and food service management in one of the classes that I teach at Lehman College. This is actually what we're teaching this semester. And there's so much that goes into food handling, between time and temperature controls and safety measures and how long or how short things are sitting out, whether or not you receive things that have to be frozen or heated, when you are putting things into storage, when you are inspecting your deliveries, when they get delivered to you. There's so much that goes into what a restaurant or a food service establishment has to do. So just in general, any food establishment can be inspected by the New York City Department of Health. And you can see under there, they look for things like food safety, time and temperature issues, how food is handled, like are people sneezing on things and not using gloves, temperature I mentioned too, personal hygiene, like if they have dirty aprons or they're not using gloves properly, and things like vermin control. I mean, it's just going to be the nature of the game, my friends, especially in the city. We have a ton of rats and infestations and mice and cockroaches and ants and bugs, etc. But you throw food into the mix and these things just come a running because they want to eat all your yummy stuff. But there has to be ways that these things are being controlled. So there's pest control policies in place as well for these food establishments. So then by law, in this particular municipality, but really pretty much across the country too, they have different localities that require restaurants to post their letter grades. So before I advance to the next slide, I'm just going to give you a second here. If you don't know the answer already, what do you think about violations in comparison to the letter grades that are given? So for instance, if somebody has an A grade, do you think they have no violations whatsoever? Or is there like a minimum amount of violations that they're allowed, or a different level of violations that they're allowed? If you feel like adding that to the chat, please do. Or if you just want to think about what they might entail, you can think about that, and you'll see in a second as I advance to the next slide what that means. So here we go. Letter A grade. An A grade that people proudly post on their restaurant windows can actually mean that that establishment has up to 13 violations. A B grade is anywhere between 14 to 27 violations, and a C grade is more than 27 violations. We might also see restaurants post a grade pending. This is a bit of a grace period where they can kind of like fight or ask for an appeal or be given an opportunity to correct those violations. So if you see a grade pending, that actually means that the establishment has had at least 14 violations, 14 or above violations, and the inspector is saying to them, you have a grace period to correct this, or, and we're going to come back and reassess this, reinspect this. So the violations themselves, they have broken down into a couple of categories. They have sanitary violations where the food itself is being messed with in some way that can cause an outbreak to happen or foodborne illness to happen. So that's a little bit more on the scary, serious end of things. I'll show you in a second. You'll see in the violations, anything written in red is considered the most critical. So again, these food establishments can prioritize what they need to fix. And then the last thing could be just other violations, like maybe they forgot to put the letter grade in their window, or they forgot to hang up some other kind of information like the menu items or the calories or whatever it is. There's not as threatening of an issue there. So in New York City, and this is kind of cracking me up because I don't know if you actually want to go to this website to look these things up. I mean, you can Google NYC restaurant inspection grades, or if you want to copy paste what you see in front of you on this link. If we have time, I might click on this, but I don't think we're going to have time, and we can look up some if you really want me to. But you can check out restaurants near you, the ones that you go to quite often, and you can see when they were inspected and what grades they got and what kind of violations they had. But like I said, I would advise against it. If you really, really want to keep eating at places, this is, sometimes the unfortunate thing about knowledge may be power, but it's also kind of depressing too. I know for myself, one of the places we go to quite often, and knock wood, I've never gotten sick there. The last inspection they had, they got a C. Doesn't stop me from going there because I love it. Okay, so let me show you a few examples. I purposely saved some of my images from many, many years ago, so I'm not like calling out anything current. I don't want to put anyone on blast here, but you can see these are some of the examples. So when you go and click on that link, if you want to look up somebody's information, it's all publicly accessible. You have the restaurant name. You'll have some information about how the inspections are done, as I just mentioned to you, as far as sanitary violations and other violations, the dates that the restaurant was inspected, the grade that the restaurant was given, and then you'll also see the violation points. So here, right, this grade is an A. It qualifies. It's from 0 to 13. The violations that this restaurant got were nine violation points. And you can see here on the bottom, they only have one item in red. So there's more things underneath it. This is just an abridged version of what you would see online, but they have something that is an issue with food preparation. So there's raw, cooked, or prepared food had been contaminated or cross-contaminated or not properly discarded in some way. And then that second one, which is not as critical, is that they had something messed up with the material that we're using, right? So we have things called food contact and non-food contact surfaces. They're usually told to be like vinyl or some sort of type of material. They're supposed to be raised or pushed up against the wall or curved, what they call coving. There should be a curve to it. So that's not as critical as a food violation, because the food violation in red is something that can affect the health of a patron. So we want to make sure that that doesn't happen and that it gets addressed, but they can still, they're not getting shut down. They can still perform as normal. They just have to make sure that they're updating that and going back and training their staff and, making sure they're revisiting their control methods and their corrective actions to make sure that that doesn't happen again. All right, let's take a look at a B grade, the B grade from this taquitoria down in Manhattan. Again, these are from 2013, 2015, et cetera. So this one has a B, right? We said from 0 to 20, from 14 to 27. So this one clocked in at 24 violation points. Not great, right? And you can see there the top contenders, which put food at risk, which could potentially cause a foodborne illness or an outbreak to happen. So we have a food protection certificate. So I just mentioned to you that I teach food service and serve safe certification. That's food service manager certification. That's a course that I teach, and that is a national board examination that is good for 5 years. And so the person who is in charge of the establishment, not everybody has to get that. And in New York City in particular, I just want to side note for a sec, we do have food handlers certification courses in New York City because it's such a big city. So we have the national exam where it's called a Serve Safe Food Manager exam certification, where somebody is then certified for up to 5 years, and then they have to take that test again. So maybe somebody had it lapse or they didn't know they were supposed to be certified in it, but they have to have a certificate to make sure that they are properly approved to be managing that establishment. The second one there is personal cleanliness. So again, garments that are soiled, there's possibility of contamination, hair, nails, jewelry, like anything that could touch something or fall into something. We don't want that happening. So that puts food at risk. That third item there where the contact surface was not properly washed, rinsed, and sanitized. So even though this has to do with the surface of something, it was a food-specific critical violation because it's a food contact surface. It's not just like the flooring was made of tile instead of vinyl or whatever. Okay, so those things are their critical violations. And on the bottom here, you can see other language like backflow, which is a drainage issue, or again, the material being used for the surfaces that's non-food related. Okay, next one, poor La Isla Cafe. La Isla clocked in with 56. So that's way more than, what was the thing? 27, right? Way more than 27. 56 points for poor La Isla. Got a C grade. Again, they are required by law to post that C grade in their food establishment. That's something that they have to do while they work on making sure that they get rid of the violations. And here too, you can see the language that's used as far as what those violations were. So we have something called the temperature danger zone when it comes to hot and or cold food. And we also have time and temperature controls as well, which indicate that food is more susceptible in certain areas of time and certain areas of temperature, that they can be more susceptible to foodborne illnesses because bacteria starts to grow. And we don't want that to happen because it can definitely affect, obviously, not just the taste and the quality of something, but people can be ingesting this stuff and then getting sick to their stomach, or however severe it could be, like certain, trying to think of like parasites and viruses that could be forming or attaching onto something. Those things can cause, fatal issues or hospitalizations. So in this case for La Isla, they had a hot food item that was not held at the appropriate high temperature. They also had a cold food item that was outside of that proper cold temperature. So again, the language that you see here is not specific to what exactly the violation food item was. It's just a standardized violation terminology, but the establishment will know what they need to address through their ramifications, their corrective actions. Live roaches, vermin, not just gross to see, but they can track things and feces, and they can get into food. So we definitely don't want that happen. You can see there are two food flies and sewage issues going on there because of, again, this is sewage associated. So they probably had some area that was not closed properly, or something was getting in, and there was or maybe people forgot to go and clean something out, and maybe something spilled over into an area. So now that is affecting the vermin issue too. And then food not properly protected from contamination. Right? Like we don't want this to happen. So again, the restaurant can still keep operating. They're not being shut down. Usually we don't shut down operations unless there's like something very, very significant. Like there is an actual outbreak going on where you have to shut down and completely, sanitize the whole place and go through training, etc. Usually they're allowed to continue working and making sure that they are addressing any of the violations. Okay, let me stop here for a sec just to check the chat. I don't think anybody has any questions or comments just yet. And let's move into the challenges of dining out. We have definitely some areas of concerns, right? Like if you are dealing with managing a chronic condition or just trying to make better choices for you as far as nutrition is concerned. Obviously, we said too, this can be a budgetary issue too, because things are expensive when we eat out, because we're not just paying for the food, we're paying for the rent and the electricity bills and the staff salaries and all that stuff too, and the travel to and from things that people are getting their food from and delivered to. And especially right now, I think we're also seeing maybe a little bit of bounce back, but we definitely saw some labor shortages. So we don't have enough people on hand to not just serve the population, but also to properly inspect and protect and store and manage and keep track of all the food that is in the establishment. So this is sometimes an issue as well that you as the consumer might not even be aware of, right? You might say something like, oh, every time I go to that place, it takes so long, but you don't realize that it's also affecting all of the back end of the stuff too. So let's talk a little bit about what you can do as a consumer to maybe alleviate some of these challenges if you're dealing with nutritional concerns. So talking first with the calorie stuff, right? By nature, most restaurants will always be like, here's a whole bunch of stuff for you to eat. And you're like, that's a lot. I can't do that much. So usually you can probably just ask them before we even sit down, before my food even comes, can you give me a doggy bag? Can you give me a little tray? And I'm just going to immediately just put things on the side. take the second half of this home with me. Or you might be out with a group of people and you can split portion sizes just so if you want to control the caloric intake. I didn't mention it earlier, but some of these, when you do look up the information, some of the food items themselves could be in the thousands of calorie range for one particular meal. So if you're going to something like McDonald's, or yeah, I would probably say like more fast food places, there's going to be a very large amount of calories in a very small amount of food just because they have so much going on in one thing. The layering of the meat, the cheese, their fried French fries that come with it. Maybe a soda is with it too. So a whole meal might be 1,300 calories. And you just saw some of the examples on the high and low ends of things. One meal could be almost your whole entire daily calories worth of food. So this is where you might want to make better choices for yourself. Again, I realize, everything is kind of different factors are involved with convenience and time and budget. But this could be an option for you just to take a look first at the calories, swap things out if you want to, if you think things are a little heavy in something, like I'm thinking of Chipotle, right? So maybe you're trying to be mindful of grain-based foods. You want to cut back on some of your carbohydrate intake. Or specifically grain-based foods. So maybe you ask them, go half on the rice and double up on the beans or the guacamole or the chicken or whatever, right? So this way you're kind of laying off a little bit on some of those refined carbohydrates and you're adding in a little bit more nutrient density to your meal. You can also communicate with your restaurant staff. I mean, especially even if they have 20 locations or more, but if they're a mom and pop shop, they want to cater to the neighborhood. They want you to come back as a loyal customer. So it's possible that you can say to them, I'd love to eat here more often. I just wish you had more vegetable options, or I wish you had stuff that wasn't so high in salt. Would you consider doing that? I do that. When we go out to eat, I automatically say, can you tell them low on the sodium? Like if they can prepare something that they haven't already added salt to, I would be really grateful for that. I don't mind spending an extra $1 or whatever it might cost, but this way I know I feel a little bit safer with the foods that I'm eating. Okay, moving on to financial impact here. You can take advantage of lunch specials or early bird specials. I definitely do that too. Or sometimes there might be lower cost items on the menu, like a half portion of something. Or maybe you can also take advantage of a value added deal. Again, this could be added on in the case of calories too, like buy this and also it comes with this other thing, like you deluxe some platter or an entree, but at least you're getting a little bit, literally more bang for your buck there, right? You're getting a little bit more for paying a little bit extra. And maybe again, as far as the quantity of the food is concerned, you can maybe take some of it home with you so you're not eating it all right there. And again, being communicative, not just being a keyboard warrior and getting onto Yelp and being like, this place sucks, I hate it, but speaking to management, asking them, telling them about your experience, saying, this is really tough. I mean, these things are $16, $18 a piece. Would you consider doing like an early bird or a senior discount? Or, do you have times of the week where it's a little bit less busy? So maybe if I come on a Tuesday afternoon, it's not as expensive if I come on a Friday evening, and maybe they might consider lowering some of the costs. Again, usually the larger chains have a flat rate, so that might be a little harder to negotiate. But if you are working with a more community neighborhood place, it might be easier to get them in on that. Labor shortages. All right, so here's where you have to hopefully just be acknowledging that you might have to be flexible with some stuff. So if you're used to calling and making reservations on the phone, you might stay on hold forever and ever. Nowadays, you do have an opportunity to go onto Yelp or Google Maps or Resy or OpenTable or the website of the restaurant itself. They might have online reservations. So you could put a little comment in there if you need to speak to somebody, or say, I have allergies that I need to accommodate. And you can input information like that too, hopefully in your online reservation. If there's technology involved too, like you go to a kiosk, you type in stuff, and then you go pick up your food, and maybe they have a dine-in option where you don't necessarily have to have a staff person do that. It's just kind of like in the background, you show up. I'm trying to think of like Panera does this too, right? You can have an app and you can do a self-ordering kiosk type of thing, ... Obviously, people behind the scenes are cooking and preparing the food, but then you don't actually have to do anything. You just show up and you pull your bag off of the rack when you show up there, and showing patience and understanding. We're all going through it, friends. We're all human beings trying to make life work. in what is 100% chaos most of the time. So just try to be supportive. If you're giving criticism, make sure it's constructive, right? I always try to say, if you're going to complain about something, can you come with a solution? So you might just say, here's some feedback I'd like to offer you. You know, customer service is how people stay in business. They definitely don't want you to complain and have their customers go down. They want to make sure you're coming back. So here's something too, right? We talked about dining out, and sometimes we think of restaurants and going out to eat, but going out to eat can also mean other venues that are not your home. Graduation parties, a catering hall, someone's backyard, a picnic in the park. So if you are conscientious about the choices that you need to make, especially if you need some accommodations for nutrition concerns or food allergies, call ahead and ask a couple of things. You can call and just say, what's on the menu? Can you share with me the ingredients? I do have some issues. I don't want to show up and be surprised or end up finding out like I can't eat this stuff because it disagrees with everything that I'm bringing with me, like all of my, my medical conditions. Odds are, if you're going to an actual establishment or a catering hall facility, they're not going to allow you to bring your own food from outside. But if you're going to someone's house, if they have a graduation party in their backyard or a picnic in the park, show up with a safe dish, something that you know for sure you can eat. And or if you're buying something from outside that you feel safe in buying from that establishment, and then BYO, bring your own stuff. Choosing wisely, again, making smart adjustments, especially if you're managing something. So if you are out and there's nothing but fried foods, but you have some options of like, vegetables and things that you can include in. And I just want to take a moment here just to add a caveat. Not so much, obviously, if you're managing a chronic condition or dealing with food allergies, but like when you're going out for fun stuff, if you're enjoying yourself and you're socializing and celebrating, this is not the time to be like, I couldn't possibly have a piece of cake. You're going there to celebrate. You're enjoying yourself. You're socializing. This is part of food is not just about nutrition and health all the time. It's about socializing and savoring things and having that enjoyment factor. So don't let that be the day you decide to go on a diet, because I want to encourage you to have freedom and flexibility in what you're eating, but of course, with the caveat that if you are dealing with some sort of chronic condition, you might have to forego some of the foods there that just don't do well for you. And then maybe before you leave for this event, you've prepared some foods at home and you've eaten beforehand, so you're not showing up to this event starving. Next on the list there too is mingle, mingle, mingle. It helps to get up and move around. If you're just sitting there eating, you might be more prone to just constantly picking off your plate or keep going back up to the buffet bar and just like, piling things up, piling things up. And by the end of the day, you're thinking to yourself, what did I do? Like that was so mindless of me. I didn't enjoy anything. I just ate because I was bored. But instead, maybe get up and move around, engage in a game if somebody's doing something outdoors, or get up and dance if they're doing something dance-wise. And hopefully that'll help you with making some informed decisions for yourself and feeling a little bit better about having to eat outside of your home. So as we're wrapping up here, this is where I always like to ask you, what do you think your next steps might be? What do you think you might want to put as far as an action plan together for yourself? The next time you go out to eat, what are some of the things that you might do ahead of time or while you're there? And feel free to chime in the chat if there's anything that you want to kind of commit to out loud, or if you have any questions, you can feel free to ask me them right now as we're wrapping up the end of our conversation here. Our next webinar is going to be about inflammation and inflammatory foods. I'll define all of that on Thursday, July 11th.